is Important radio broadcast. I am Dr. M.J. Collier, your host, producer, and on-air personality, and we're to answer your healthcare questions. As always, we want you to tell us what part of the country you're calling in from. Let us know who you are, north, south, east, and west, and we will answer your healthcare questions. Thank you so very much for all you do, because we know you have alternatives. Let's get the show started now. All right. This is the Your Health is Important radio broadcast, and we're so glad that you have decided to spend your evening with us. So our topic, of course, is always the coronavirus and things that are going on with the coronavirus. So let's clear up and clarify the situation with the need for booster shots. The only booster shot that has been approved in the United States at this time is the Pfizer booster shot. So if you did not get Pfizer for your first two shots, it's really a moot point at this time. Now, Moderna and Johnson & Johnson vaccines have requested emergency use authorization. If that happens, it won't be for another 3 to 4 weeks. So you don't have to worry about that, and I will update you at our next broadcast. But for right now, the only vaccine for which you can get a booster is the Pfizer. Now, I have heard anecdotally from patients who have told me that they have gone to the pharmacies and gotten boosters just basically for asking for it. Now, the question was, and I've had resistance from some pharmacies about giving other than the Pfizer boosters, because they're not sure about the reimbursement. Since it is not approved for booster status at this point, they were concerned about getting reimbursed from either your insurance company or the federal government. But remember, the coronavirus vaccine and the boosters at this time are all provided at absolutely no cost. So insurance status is not a barrier for you. If you would like to get the vaccine, it doesn't matter whether you have health insurance or not. You're going to get the same courtesy as anyone else getting the vaccine. They're going to ask you if you have insurance. And if you do, please provide it. If you don't, there's no pushback. There's no put you in the back of the line. There's no second-class citizen status. You are treated as nicely as anyone else that comes in there. And we highly recommend that you do that. Of course, amongst those that have been vaccinated, African-American men have the lowest vaccination rate. So ladies, I please implore you, your father, your brother, your male significant other, the man in your life, please instruct them to go and get themselves vaccinated, so they will be around to, one, be your partner, two, to help raise children, and just be, part of the African-American community. There is an effect that we have noted, and a study came out earlier this week in reference to consequences of the coronavirus pandemic. One of those consequences is orphanage. There are 1 out of 500 children in the United States, 1 out of 500 have lost a parent or a caregiver grandparent to this pandemic, which means there's no one there to raise them, no one there to take them to school, no one there to see them through the trials and tribulations of childhood. And so these children are going to have problems in society. And so the recommendation of that study was that these children be followed and taken care of, basically, until they are functioning adults, regardless of the status of the pandemic or not, because they have been so negatively impacted. So we have not seen a phenomenon like this, with so many children basically now abandoned. They have no families. And so they will have to be there in the system, acutely so. Sometimes family members can take them in and care for them, but that is not an immediate transition oftentimes. Sometimes they have to be legally transferred, and there's a process, and that process is backed up, just like most social and clinical services right now, due to the coronavirus vaccine. So, and we want to have and make sure that we're protecting ourselves. And so if you have questions or concerns about the vaccine, if you're vaccine hesitant, if you're vaccine militant, saying I'm not getting it under any circumstances because fill in the blank, I want to talk to you. I want to hear what it is that your concerns are in reference to the coronavirus vaccine, and why you haven't gotten it, why you're concerned about it, what you're waiting on, if you are waiting, and to see. This is a conversation that needs to be had, and there are valid concerns and considerations that I would be happy to discuss. But if I'm able to provide information to you that will help change your mind, so to speak, and get you in a positive way thinking about the vaccine. For patients that I have in my personal practice, I have instructed them to get it. I tell you, the emotional burden that is removed once you've gotten it, because now you don't have to worry about getting it. You don't have to worry about getting the disease. You don't have to worry about being out of work. You don't have to worry about possibly being hospitalized. And understand this: when this pandemic started, almost now 2 years ago, the government, the federal government, was guaranteeing hospital bills for people. So if you were hospitalized with the corona, no matter how expensive the hospital bill was, and if you go on a ventilator, your bill is going to be anywhere from $500,000 to $1 million. But the government, the federal government, was paying for that. Guess what? They're not doing that anymore. So if you're hospitalized, the average cost of a person with COVID going into the hospital now is $55,000 that they owe upon discharge. Now that is again far beyond my capabilities to pay, and far beyond most people's capability to pay. In the good old days, hospitals would be philanthropic and say, well, we're a nonprofit, we're going to write this off, and you wouldn't necessarily have to worry about those charges. That is totally and completely different now. Nowadays, hospitals will come after you like any other creditor and ruin your credit, put liens on those things you own, including your salary. It can be a lot of negative consequences to that. So it's very important you look at all the consequences to not being vaccinated. A lot of employers now are mandating it, particularly those that have federal jobs, and those that have federal contracts. So even if you don't work directly for the feds, your business that you're working for may have government contracts that require all contractors and consultants to require vaccinations. And so you may find that your employer, basically their hands are tied and they're requiring you to be vaccinated. Now, there are a couple of famous cases. We got a basketball player who up to date has refused to be vaccinated, and he's in New York, and at first he was going to get part-time status and only play in places where vaccination was not required. But his home place in New York requires the vaccine. So he was not vaccinated, and so that was going to cost him, and at this point still costing him millions of dollars. So we'll see how that story ultimately ends. Of course, it is personal choice. It is always personal choice. But your choice is, if you choose not to get the vaccine and be vaccinated, be fully vaccinated. That means 2 doses of the 2-dose vaccine, 1 dose of the Johnson & Johnson. Then you won't be able to travel. You won't be able to go to certain restaurants. You won't be able to go to certain venues, nightclubs, etc. If you cannot confirm your vaccine status. So this is one of the things that we want to definitely want you to take into consideration. And remember, the number of young people that have been negatively impacted. These are not kids that got the disease. These are kids whose parent or grandparent, who were their caregivers, got the disease and died from it. 1 out of 500 children in the United States of America today. That is a startling statistic, and one that we have to make sure we as a society adapt and come on strong to. So, Antonio, let's get to the callers and see what we have here on the questions. Antonio is my producer and on-air personality. He is going to be joining me live for the very next broadcast. So you get a chance to meet him, greet him, and he's going to be screening your calls. He does that in real time now, but you'll get a chance to meet him. So once again, let's see who we have in the chat room. Who's got questions? All right, no questions have been scrolled at this point. So we're going to just continue talking about what we have here. So this is Breast Cancer Awareness Month. So women, if you have not had your mammogram, if you're over age 40, or if you have a family member, a sister, an aunt, your mother, your grandmother, then no matter what your age is, you need to be screened. You just need to make sure that you make your insurer aware of that. And but even so, a lot of hospitals will offer mammograms for as little as $99. And so if you have to bite the bullet to pay for that to get your mammogram, then don't hesitate to do so. Same thing with colonoscopies. If you have a member in your family, a first-degree relative that has been diagnosed with colon cancer, I don't care what your age is. Right now, the screening recommendation was 50. It is now down to 45 for African Americans to be screened. And if that person tests positive, then everybody in the family, no matter what age they are, need to have a colonoscopy and be screened. But for the breast cancer, the great thing about breast cancer mammograms are the mammograms are now so high tech. They are 3D. They are in color. it's literally like opening up your breast and looking at the tissue. So it's much easier to make a correct diagnosis. A lot of false positives that were given when they were only using 2D of a mammography, two-dimensional, which is up, down, left, right. And then they see things and they weren't sure it was anatomy or not. They would always say, well, need to get a confirmatory ultrasound. I need to get even now MRIs. So with this 3D breast technology, it is just really incredible the amount of detail and things they can see, and lesions that would have been missed previously that are only a few millimeters in size can now be adequately diagnosed. And then, if necessary, a needle guided biopsy using the 3D technology or an ultrasound to make a correct diagnosis if a woman has a benign lesion, which is good. This watchful waiting, I tell women, I say, don't just get a biopsy, just get the lesion removed. That way you don't have to worry about it, because the biopsy can miss the lesion. The biopsy can be negative today and then convert to positive over time. They're going to say, well, instead of you getting a mammogram once a year, get one every 6 months. That is a lot of headache and hassle to decide. One, in stress. You're always concerned and worried. Every time you get a bump on, something on your chest, you're going to be thinking, oh my goodness, do I have breast cancer? And so it's easy enough to just remove the lesion. Is one step past the biopsy. One additional step does not deform the breast in any form or fashion. And once it's gone, you have the answer. You don't have to worry about that. You're worry free. So you don't have to worry about that. So ladies, go out and get your mammograms. We want to make sure this is Breast Cancer Awareness Month. You're going to see a lot of parades and events and walks and marathons and runs supporting pink. So we want to do that. We like to support our ladies because breast cancer is the number 3 cancer in women. The number 1 cancer in men and women is lung cancer, regardless of whether you have a history of smoking or not. That is how bad cancer has become for us. So, can I see the comment on the screen? I cannot. Let me see if I can enlarge it. Okay. Oh, can the lipo drops help with type 2 diabetes? Hey, Adrian, thank you so much for tuning in. I apologize. I could not see the comment on there. Lipo drops help with weight loss. Weight loss helps with type 2 diabetes. So the indirect answer to the question is yes, but the lipo drops are not indicated to treat any disease process, but weight loss is good no matter what. Anything from migraine headaches to depression to knee pain to high blood pressure, diabetes, high cholesterol, weight loss has been shown in as little as 10% of your body weight, no matter what size you are. If you're 100 pounds, you lose 10 pounds. If you're 400 pounds, you lose 40 pounds, has a substantive and significant impact on how your body responds. And so diabetes will improve with weight loss. The lipo drops help with weight loss. So indirectly is the answer to your question in doing so. So yes, particularly the lipo drops maximum strength formulation used under the tongue before meals, so up to 3 times per day, will result in weight loss, decrease abdominal fat, and that situation improves the symptomatology and the disease state of type 2 diabetes. You want to lose that abdominal fat, lose the muffin top with lipo drops. So the answer to the question is yes, but indirectly. Rhonda Postlethwaite, what do you suggest we take before we get the shot, and what's the best one to get? Great question, Rhonda. One, the Moderna is the best one to get. It has the highest immune response. Even the Pfizer and the Johnson & Johnson people acknowledge that it's the best one to get. But the second choice is whatever is available, anyone that you can get. So, but my pecking order would be the Moderna shot, the Pfizer shot, then the Johnson & Johnson. The Johnson & Johnson, particularly with a booster shot, has been shown to be very effective against the coronavirus, particularly the Delta variant. So it would also be one that you could consider, but whichever one is available. But if you go in and ask for it, and I tell my patients to go in and ask for it, I oftentimes will give a prescription requesting the Moderna, and I send them to a site that I know has the Moderna. And the things that you should take before you get the shot, you should take an anti-inflammatory such as Motrin, Advil, or Aleve. An anti-inflammatory stops the inflammation, which decreases the side effect profile exponentially. So you don't get the sore arm, you don't get the body aches, you don't get all of those things. And then a non-sedating antihistamine, because an allergic reaction is a histamine response. Ergo, you take an antihistamine to prevent that from happening. There are 4 non-sedating antihistamines on the market. They are Zyrtec, which is cetirizine. There's Xyzal, which is levocetirizine. There's Claritin, which is loratadine, and there's Allegra, which is fexofenadine. They all would work, and everybody has, a favorite amongst those groups. They're all readily available at any store. You start taking it the day before you get the shot. You take it the day you get the shot, and you take it the day after you get the shot. 3 days is usually long enough. If you want to keep taking it for a total of up to 5 to 7 days, that is fine too. That would just minimize your side effect profile, but would not negatively impact your immune response. There were questions initially about taking naproxen and Motrin before you got the shot and whether it would impact your immune response. That was found not to be true. So now we know that you can take those and you will not have any issues with your immune response. So that's the answer to your question, Rhonda. Thank you. Great question. Patty, why not? I love that. What can you do to keep help with keeping your potassium level up without a lot of pills? Well, potassium is very, very common in most citrus fruits. That would be grapefruit, orange juice, etc. There are also very high concentrations in bananas. So you have to eat those things to help keep your potassium level up. But the simple and elegant solution is to take a potassium supplement. They are, inexpensive. And I would take, at least the unit of measure is milliequivalents, at least 10 milliequivalents. If you're on any kind of a diuretic medication, a water pill, if you will, those, the primary side effect of those is that it can cause your potassium to go down. If that is indeed the case, then you need to take that supplement prescription strip. You can't eat enough and drink enough of potassium in foods to maintain that level. So taking a potassium capsule, they come in 10 milliequivalents or 20 milliequivalents, and you can take some variation of those numbers to increase the dose if you need to. Most of the time, if I give a person a diuretic, I will give them at least 10 milliequivalents potassium tablets to take along with that. If I give them a higher dose diuretic, or if I have them on Lasix, which is a loop diuretic for aggressive diuresis, as if you have swelling in your legs and feet, then I would give them 20 milliequivalents of potassium. So potassium, very important. The reference range on potassium is 3.5 to 5.5. It's a very small and closed window. When your potassium gets below 3.5 or above 5.5, either one is a bad situation and it's critical because it causes cardiac arrhythmias, and you can have a fatal arrhythmia or a heart attack or a stroke. So you can't walk around with a low potassium or a high potassium for any extended period of time without facing some serious and significant sequelae. So that's your story on potassium, Patty. Thank you so much. Great question. Donna Austin Turner, can I take the vaccine if I had Guillain-Barré in 2017? Guillain-Barré is one of those unique situations that is called an ascending paralysis. It starts in your feet and it moves up your body until it gets to your chest. Hopefully it will not impact the diaphragm, because if it does, you sometimes even have to be placed on a ventilator. But for most people, it just starts at the feet and rises and goes through the head and spontaneously resolves without you doing anything. You just have to get through it. If you've had that, you're definitely one of those individuals that should take getting the vaccine into consideration. I would definitely discuss it with my healthcare provider, and definitely take the precautions that I mentioned, an anti-inflammatory and a non-sedating antihistamine to minimize your chance of having that, and be prepared in case, because it does happen. It happens with the flu vaccine. It happens with a lot of vaccines. There have been no outlying cases that say, oh, you're getting a lot of Guillain-Barré with the coronavirus vaccines, but it has happened. And so it is something to take into consideration. I know it probably scared you a lot back in 2017, because when you're paralyzed, and you're hoping that it comes back, and then it slowly does. So the miracle happens. But I would definitely take that into consideration. I would consult my neurologist and or my primary care doctor to get their advice on your particular case. Great question, Donna. All right, Linda Johnson, 18 weeks pregnant. Is it safe to get the COVID vaccine? It is not only safe, it is recommended, Linda. So at any stage in pregnancy, if you just got pregnant, if you're about to deliver, you benefit from the vaccine. The baby benefits from the vaccine. The baby gets your antibodies through the placenta and the umbilical cord. And so the baby is born with protection. And guess what? You breastfeed that baby after the baby is born, you give them passive immunity as well. So they'll get a double dose. I actually had a very good question. A lady had just had a baby. She had the vaccine, and she learned that you could pass the antibodies on by breast milk. So she knew the baby was protected, but she was concerned about her older children, 2 and 3 years old, who even once they get the vaccine down to 5, they won't be eligible for vaccine status for probably another year or so. So she says that would it be safe to give them breast milk and give them immunity? I said that is a wonderful idea, and one that definitely would be safe is her breast milk and her children. So it should not be an issue or a problem. So I think that they would definitely benefit from drinking the breast milk as well and getting vaccinated secondarily. So the recommendation is 18 weeks pregnant. Yes, Linda, get that vaccine. Again, I still recommend the Moderna, then the Pfizer, then the Johnson & Johnson as well, and then have a safe delivery and pregnancy. So proud of you for even asking that question. Thank you. Cheryl Jenkins, does the Lipo Drops Max work better when both drops are taken together or when the drops are spread apart? I would recommend that you take them depending upon how much you want to lose and how quickly you'd like to lose it. You take it with at least once a day, but people sometimes will take it before breakfast and before dinner. If you want more aggressive weight loss, before each meal, breakfast, lunch, and dinner. And the Lipo Drops is key. You place the dropper under your tongue. You hold the Lipo Drops under your tongue for approximately 2 minutes. Then you swallow. The work is done by the medication or the supplement being absorbed under your tongue. That's called sublingual administration. That is as effective as getting an injection. And that's why this product was developed, because there's an injectable weight loss product called LipoVite that's very popular. When you see the term medical weight loss, that is one of the things that they use in medical weight loss clinics across the country. And so, but a lot of people, they just couldn't take the time to come to the doctor's office over an extended period of time. Everybody does it initially. And even though they may be having great success, life intervenes and they just can't go to the doctor's office every week to get an injection. So there are actually facilities that would give people syringes and allow them to inject themselves. Dr. Collier does not do that. And so we said, what can we do to make it convenient for the patient? The Lipo Drops product then was born. So sublingual application under the tongue, 1, 2, or 3 times, depending upon how aggressive your weight loss is and how quickly you want to lose it. Again, amazing results with the Lipo Drops product. Great question, Cheryl. Thank you so very much. Mrs. Webb Sr., I have acid reflux and I take all the Lipo Drop supplement. Is that good? Yes, it is. And our probiotics will be absolutely great to help with the acid reflux. And then simple things for people that suffer from acid reflux. Acid reflux is a response to 2, oftentimes eating too fast, 2, oftentimes taking too large a bite of food or putting too much and swallowing too much at one time. So it requires a conscientious effort to slow down what you're eating and how fast you're eating it, and then also to take chew. You're supposed to chew every bite 15 times. Now, nobody does that, so we understand. But I would take a conscientious effort to take smaller bites, longer time between bites, and then don't eat within 3 hours of lying down to go to bed. That is the absolute worst circumstance, because nowadays, we used to eat dinner at 5 or 6 o'clock in the evening. Now we're eating dinner at 9 o'clock at night and going to bed at 10. So you're laying down on a stomach full of food, and that virtually guarantees that you're going to have some problems with reflux. So I highly recommend that lifestyle change is key. And then antacid products like prescription strength Pepsid, which is 40 milligrams, over-the-counter Pepsid AC, 20 milligrams, over-the-counter omeprazole, Nexium, which is 20 milligrams. Prescription strength is 40 milligrams. Many great prescription drugs to help with acid reflux. So follow up with your primary care doctor, get some information about what works best for you. But in addition to taking the medicine, those lifestyle changes are very important. Okay, Barbara Brown. Great question. I had a question I put in earlier about those who got fully vaccinated with Pfizer. Will we need continuous boosters? No, you won't need continuous boosters, at least not now, based on the current recommendations and the current response to the original A-type coronavirus, which is the original infection, and now down to the Delta variant. Again, even the Pfizer is showing great response to the Delta variant. There was just no reason really for people to be recommended that they get boosters unless they had immune compromise from either say cancer treatments, chemotherapy, they had a solid organ transplant such as a lung transplant, a heart, or a kidney transplant, or they just did not have a good immune response after getting the vaccine the first time. Those are the individuals that it was recommended by the doctors and the scientists to get boosters. But then the CDC came out and said everybody should get boosters. There's literally just no clinical reason for that. And a lot of the doctors protested about it because it just, there was no reason to direct people to do that. That is also why there's more of a lag in approving the Moderna vaccine booster and the Johnson & Johnson vaccine booster because there's just no urgency about it, because the 2-dose regimen that we have is providing more than adequate and very effective protection against the coronavirus. So remember, it doesn't necessarily mean you won't get it. It does mean you won't be hospitalized and you won't die from it. So we are still in the great ranges of protection from that. But the antibody counts themselves with the Pfizer vaccine dropped below 50%. And that was the data that they utilized to recommend that people get boosters. Now, a booster, getting a 3rd dose of the Pfizer, will improve and increase your immune response. But how much is enough, and how good is good enough? If you need to be at a level of 10 and you're at 9 after 2 shots, and you get another dose and you're now at 15, but 9, 10 works adequately, you have to weigh the risks of potential side effects, adverse events, and allergic reactions to the benefit that you would get from a 3rd dose. So you can get one, but at this point, continuing boosters are not being recommended, even annual boosters, unlike the flu shot, which is because the flu virus changes every year, and you have to get a new vaccine that's targeted toward that particular flu virus that's coming along. The thing about the flu vaccine is if it's 50% effective, that's considered a hit. I think the best they have ever done with the flu is 65%. Oftentimes it has fallen below that to 20 or 30%, yet people go and flock and get their flu vaccines. I want to see that same enthusiasm to get the coronavirus vaccine, because we have shown 95% efficacy with that, unparalleled in vaccine therapy. And we're going to see just a great response in how viral illnesses are treated now, because this is a new weapon in our armamentarium. We now are able to effectively treat a virus. We did not have that ability before. All we did was treat the symptoms, and people survived or they didn't survive. But now we can actually go against this. Go ahead. Great question, Barbara. Billy Sue Combs, I'm having a colonoscopy being done, and they're going down my throat as well because I'm anemic. I'm concerned. I'm 47. My doctor is not worried. Is that true? That's absolutely correct. The first step for anemia in an adult, particularly if you're not having problems with heavy menstrual flow in a female, that's the first choice. That is, menorrhagia or very heavy periods that cause your blood count to go down. If that is not the issue, or you've had a hysterectomy, or you're menopausal, then the next step would be looking in your stomach. So a colonoscopy is first. Looking down your throat is called an upper endoscopy. They're looking for ulcers in your stomach. They're looking for ulcers in your upper part of your small intestines. They're looking for bleeding lesions in your colon, anything that would make you bleed and you're just not aware that you're bleeding. Oftentimes, signs and symptoms of GI bleeds would be dark tarry stews, because the blood is digested and it makes the stew very dark and it looks like tar or coal. So that's one of the key indicators. They can also do a digital rectal exam, get a specimen, and tell you in seconds whether you have blood contamination. Now, that test is not 100% accurate, because you could have eaten a medium or rare steak, and that would also test positive because there's blood in that meat. But if you have bright red blood coming out of your rectum, then that's a no-brainer. You know that there's a problem. That either means you have a lower GI bleed or a very bad upper GI bleed, and that is a medical emergency and it needs to be treated very aggressively. So that's the right order of things. They're doing the right things, and they're concerned about anemia, but they're looking for things just to make sure that they're not missing anything else. But anemia, again, number one cause in women of childbearing age is a heavy menstrual cycle. If not, then you look to see if there's anything going on in the GI tract. They're doing the right thing. Billy Sue, that is a great question. Thank you so much for sharing with the audience. Miss Audrey, how are you? Do you think you will see similar hospitalizations and deaths this winter as we did last year? I think we're actually going to see more. If particularly we have the double pandemic, which will be a flu pandemic in addition to the COVID, because we're just not going to be able to adequately treat those individuals. We won't have enough space to treat them in hospitals. It's going to be a big problem. And with so many not vaccinated, are we more likely to see more variants? With those individuals that are not vaccinated, they are putting the general population at risk. If we could get to herd immunity, there would be no active host for the vaccine to live in and to create mutations. So it would just die out over time. But we are giving it a chance to continue to mutate, and Mother Nature will find a way. So if we see that that is happening, and that is a big problem, we're going to see this prolonged. We would not be in the condition that we are in now if we had reached the vaccination status that we're at right now 6 months ago. But there was a lot of enthusiasm when the vaccine first became available, and then you had the hesitant people who ultimately did get it. They just took a long time to get it, and now you have out and out militancy. I'm not getting it. I'm not going to ever get it. It's my body, my choice. I'm not going to. And those are the individuals that are putting not just themselves at risk, but the general health of the population in general. And so that is why now these things are being mandated, and mandates do work. We're finding compliance up to 90 to 95% in places where they're requiring mandates. Unfortunately, the governor of Texas just issued a ruling, said no mandates for anybody, including even healthcare workers. That has no basis in logic, common sense, or anything else. That's just politics. And so that's going to come back and haunt him, and it's going to haunt his constituency, because if they follow those guidelines, you're going to have much higher rates in Texas for a longer period of time. Great question, Miss Shanae Ingalu. We're so glad that you participated. Ursula Clark Holmes, what age can you start taking the lipo drops? You can take them starting in early adolescence. The recommendation is 18 years or older, but we are having teenagers that are overweight that are getting lipo drops and starting to exhibit great weight loss. Dr. Collier is not recommending that. I'm just telling you what is happening. But again, 18 years and above is the recommended range to start taking it. Younger people still have the options of eating healthy, exercising a lot, going outside to play, getting them off those video games, getting them off the couch, and just routine random play. That's one thing I learned. I was working with the program with the NFL called Play 360. And in that, the objective was to get kids to play for at least 60 minutes, 3 to 4 times per week. And so what we learned is when the program first started, if children can't play football, basketball, volleyball, or any skilled sport, they're reluctant to be out in front of their peers and contemporaries and not be good at what they're doing. So we had to come up with unstructured sport, just running around, jumping rope, chasing, 1, 2, 3, 4 red light, anything that got you moving, but didn't require a major skill set. And so that being the case, anybody could participate. And then once we had parents join in, it just changed the whole philosophy and the culture. As in, you get out and play with your kids the way grandparents and parents used to play with the kids back in the day. And so you get out, you get dirty, you get down on the ground, you do whatever it is you need to do, but keep them moving, keep you moving, and everybody benefits. So great question, Ursula. I appreciate you. Okay, Ms. Way, I've seen you once again. I bought a lipo drops last year. It's still good. There's no expiration date. There actually is an expiration date on the bottom of the bottle. If you turn the bottle upside down in the circle there, it has it. It's printed. So it depends on how you have stored it. But if it's more than a year or one, why didn't you take it? If you got it, you'd have lost weight by now. But if not, my recommendation would be to just toss that one and get your new one. There's plenty readily available. And I'm not sure whether you got the maximum formula at that time. Now we have the Lipo Drops Max, which is 10 times more potent than the original formulation. And so you probably will get a greater response to that as well. But once you order this one, take it when you get it. Don't let it sit on the counter like unopened bottles of vitamins that people have. Everybody has supplements and things that they have purchased, and oftentimes they never even open them up. When they do, they take them once or twice, and then they sit on the counter or in the medicine cabinet and deteriorate until they're finally gone. And so it's important that you do that. Take those supplements, take them when they're fresh, and and get the benefit that you paid for. You want the weight loss, so use the product. All right, great question. Nina Brown Strickland, does having a breast enlargement have any relationship to breast cancer? No, there have not been any. If there was, there'd be a lot of breast cancer going around. What breast enlargement can do is cause difficulty getting an accurate mammogram. So it depends on what type of breast enlargement that you have. There are saline implants, there are silicone implants. The silicone make it more difficult to evaluate normal breast tissue. But I need to take a drink. Okay. But the way that the breast implants are done now, particularly if it's a solid pack, that pack is readily identified, and it just sits on, it can sit on top of the muscle of the chest and elevate the breast tissue, so it does not necessarily negatively impact your ability to get a great mammogram. And the new 3D technology that they have, three-dimensional scans with color, also make it easier to do so. So no relationship with getting a breast enlargement or to having breast cancer. But again, diagnosing breast cancer can become more of an issue with breast enlargements. Kevin Scruggs, I'm 52 years old. Can I go ahead and get the booster shot now? Yes, you can. They're not turning away anybody to get the booster shot. But if you have the Pfizer vaccine, it will be very easy. If you have the others, most places are not turning around people, although the booster shot has not been formally recognized and or authorized, but people are getting them. I have patients that come into my office every day. I have patients that call me on the radio and tell me I got my booster, and of all ages, so they are more concerned with getting shots in the arms than they are with following obscure rules. So yes, you can get it. Plus, African American male, 52 years old, that qualifies you right there. We're one of the highest groups that's being infected. If you have no other risk factors, if you have the traditional risk factors that we have, high blood pressure, diabetes, high cholesterol, then you qualify anyway. So you should not have a problem. But I would go to a user-friendly outlet like your usual and customary pharmacist, where people know you. They'll be more enthused about giving you the booster, and I think you'll be okay. So great question, Kevin. Great question. Okay, Sylvia Jones says, what can I do for sciatic nerves? The sciatic nerve causes pain in the lower back that radiates down the leg. It can stop it can go straight to the hip. It can go down the mid thigh. It can go to the knee. It can go below the knee to the mid calf. It can go all the way to the bottom of the foot. So sciatica is really a difficult disease to treat, but it can be treated, in the most effective treatment is conservative, i.e., anti-inflammatory medications such as Motrin, Naproxen, diclofenac or Arthotec, anything, any anti-inflammatory, and a muscle relaxant, and then some exercises. This is the time to get to know your friendly neighborhood chiropractor. This is one of the reasons chiropractors are in business and have such large practices, because chronic back pain, particularly sciatica, can be disabling. And you go and get your back straightened out, and all of a sudden you don't have that pain. In men, it's oftentimes something as simple as wearing a big fat wallet in their back pocket. That place where the wallet sits is directly above the sciatic nerve. So you're literally mashing the sciatic nerve when you sit on a wallet, particularly on a hard seating surface. But so I tell men, take the wallet out of your back pocket and either put it in your front pocket or don't carry it at all. Just carry money and one or two pieces of ID. That's all you need to do, but not a big fat wallet. And then, that can relieve those symptoms. But ergonomics of your workplace, your posture when you're sitting, your posture when you're driving, all of those things can come into play. It's rare that sciatica is caused by an acute injury like a slip or fall or a car accident or something like that. Sciatica is one of those things that kind of happens over time, and it's usually not necessarily associated with an acute injury, but more so a chronic irritation or aggravation. A lot of my patients that are in the hair care industry, beauticians and barbers, because they're standing all the time and they're bending and twisting and holding their arms up, they all have neck issues and they all have back issues because they're leaning over, and this is not good. And sciatica is one of the things that can bother them as well. Great question, Sylvia. We appreciate you. Tanisha Walker Raindrop, I love that name. I have microcardiogenic syncope. Would it be okay to take the lipo drops? Yes, no contraindication with it. Will not affect it. Lipo drops have no stimulants. They are only amino acids, those amino acids that are necessary to effectively metabolize fat in your body, because the reason that we start to lose the ability to metabolize fat and it becomes harder to lose weight as we age is because we now have ineffective levels or no levels of these amino acids. So that's what the lipo drops have in them, and they would not affect the syncope or your microcardiogenic syncope in any form or fashion. So you should feel comfortable taking it, but again, you can always consult your cardiologist and ask them whether they see any contraindications, but Dr. Collier is telling you there isn't any. Okay, great question. Okay, Val Height. Hey, Val, how are you? So good to hear from you. I'm taking Rebelsos. My glucose is 70 when I wake up in the morning. Should I still take the Rebelsos on an empty stomach? Yes, you should, because the Rebelsos works in a glucose limited at a glucose limited rate, which means if your blood sugar is low or normal, it doesn't do anything. So it won't make your blood sugar drop anymore, because that's not what it does. So that is absolutely a great response. And more importantly, the Rybelsus is an oral medication that's used to treat diabetes that literally makes you lose weight. So it is a phenomenal thing, because one, it helps lower your blood sugar, it helps lower your hemoglobin A1C, but it lowers your weight. I mean, you lose weight dramatically while taking this medication. So this is a great benefit for people with high blood pressure, diabetes, high cholesterol, etc. And so it's just a side effect that everybody likes and appreciates. People that aren't diabetic, they all want to be on the Rybelsus, but you can't get it unless you're diabetic. And if you are diabetic, the starting dose is 3 milligrams, and you take that medication upon awakening. So basically on the empty stomach, and it needs to be on your stomach for ideally 30 minutes. That's a little much. I tell people, keep it by your nightstand. When you wake up in the morning, take the pill to 4 ounces of water. This is one that you don't take with a full glass of water, amazingly enough. And then start your morning routine. Wash your face, brush your teeth, etc. By the time you get to any other medication that you have to take, it'll be out of your stomach and into your system, so there won't be any conflict. But it's not like anything bad is going to happen if you don't wait at least 30 minutes. It still works. It just works better on an empty stomach. And the thing that does, it decreases your appetite, stops you from wanting to eat, and again, lowers your blood sugar, lowers your hemoglobin A1C, the key most important point, and results in dramatic weight loss in anybody who takes it that's diabetic. So great question, man. We appreciate you. Travis Scott. Hey, Travis, how are you? Hey, doc, I've got to get a single shot. How can I prevent the side effect, etc.? Flu-like symptoms. 1, non-sedating antihistamines, Zyrtec, Zylol, Allegra, or Claritin. Start the day before the shot, taking anti-inflammatories such as Motrin, Advil, or Aleve. Those things are their recommendation. Their recommended over-the-counter dose is literally about half of the prescription strength dose. So I tell people to take double whatever it says on the bottle to take, provided you have no contraindications to taking an NSAID, which is a non-steroidal anti-inflammatory. That means you're not on blood thinners. That means you have no problems with bleeding or coagulation, and that's the vast majority of people. And again, you cannot substitute an anti-inflammatory for Tylenol. Tylenol is a pain medication. It is not, I repeat, Tylenol acetaminophen is not an anti-inflammatory. So it will help with your headache, but it won't help with your inflammatory symptoms. So it will help with body aches and myalgias, which is muscle aches, and joint pain, which is arthralgias. But you want an anti-inflammatory so you don't get those problems, because they're caused by inflammation. All of the side effects that you get with the coronavirus, the disease state, and with the vaccine are due to inflammation. So you take an anti-inflammatory, you don't get inflammation, you don't get the flu-like symptoms that you so eloquently described, Travis. So great question, man. So start that the day before you get the shot. Take it for the next 2 to 5 days. I tell people the day of the shot, the day after the shot at minimum, and you just won't have any effects. So you'll be asking, why did Dr. Collier tell me to take that medication? I didn't have any problems when I took the pill. Exactly. You won't have any problems, and you won't know why you didn't, but that's why you didn't. If you don't, you'll still get benefit because some people wait until they start to have the symptoms, but it's much easier to prevent you from having the symptoms and you never get the inflammation than it is to bring the inflammation back under control once you have it. So much easier to do that. Just be preemptive. Again, this does not, and has been shown and scientifically proven, that taking an anti-inflammatory and an antihistamine before getting the shot does not negatively impact your body's immune response, so you can protect yourself. Because at first they said don't do it, then they said but you can do it the day after the shot if you have symptoms. Then they said, well, okay, you can take it. Dr. Collier has been telling you the entire time you can take it with no problem. Okay, great question. Cheryl Quinn, my husband has been dealing with swelling in his feet, and he can say it's painful. He's not diabetic. Well, swelling in the feet is most often caused by circulatory problems, and it can be something as simple as posture, either being on your feet all day, and now your veins are starting to dilate, so you need to wear some support socks, over the calf support socks, not necessarily compression socks. Support socks are compression socks, but compression socks have to be medically recommended and are much more expensive. support socks, like your basic soccer sock, you can find them anywhere. You can go to Amazon, you can go to any store, get over the calf. That means they come up up to your knees, and they will close the space so there's no place for the fluid to collect. Now, if your husband is coming home and his feet are swelling, and then by the time he wakes up in the morning, they're back down, that means it's strictly a gravity phenomenon. The fluid is just collecting as the day goes on. So the compression socks would help tremendously with that. Now, if they stay swollen, regardless of whether he's lying down or not, they need to be evaluated for cardiac problems, kidney problems. It could be congestive heart failure. It could be kidney disease. There's so many other things that is one of the initial symptoms of. And you can fight it now and do something about it and get a great response versus waiting until it's beyond repair. So he needs to have a comprehensive physical examination. Make sure that he lets the doctor know that he's having trouble with swelling in his feet. Make sure the doctor takes his shoes and socks off and actually examines his feet. So many people come in with that complaint and they never take their shoes off. The doctor doesn't, and the doctor doesn't care one way or the other, I guess, doesn't examine the feet, even though that's the primary area of complaint. So when a person comes in and tells me they have hemorrhoids, I have to examine them. They say, you have to look down it. Yes, I do. That's where the problem is. So we have to take a look to see what's going on. So that's a common sense scenario. But oftentimes in healthcare these days, they're so rushed trying to see so many patients that you have to ask for and passively aggressively demand what you came in for, because they're going to go, do the standard things that they always do. And your husband's concern is the swelling in his feet. So get him into the doctor as quickly as possible to have that evaluated. Great question, Sherry. We appreciate you. Charlotte Populus, I love that. Can you take lipo drops while taking blood pressure, AFib, and blood thinners? Yes, there's no contraindication to any of those products because the lipo drops are just amino acids. They have no stimulants, so it doesn't affect your blood pressure. It doesn't irritate or aggravate your heart rate. It won't aggravate your atrial fibrillation, and it won't affect your blood's clotting ability one way or the other. So the lipo drops are compatible with those disease states. Once again, I would say you can ask in conjunction with your cardiologist, who, if you own those things, you should have a cardiologist, and let them see what the ingredients are. They should sign off and agree on them. But there's no contraindication to with those medications because there's just nothing to interact. Okay, Tyrone Norma, will Pfizer vaccine cause hair loss or slow hair growth? That is something that I have had patients ask about. There's been no documented cases of any of the vaccines, including the Pfizer, causing hair loss or slow hair growth. But the actual disease state of the coronavirus has noted to cause hair thinning and hair loss because it causes inflammation of the blood vessels on a cellular level. That is why people get the pneumonia and the lung disease, etc. And if it affects the cellular level of your hair follicles, then your hair follicles are not getting blood, ergo they're not getting oxygen, so the hair is not being fed, so the hair follicle dies and the hair falls out. So that can happen, and much more often happens with the disease state itself versus getting the vaccine. Once again, no documented evidence that the Pfizer, the Moderna, or the Johnson & Johnson vaccines have been associated with hair loss. There have been more doses of the Pfizer administered than any other vaccine. So if this was a problem, you'd be hearing about it. It would not be a secret. And I tell people, they say, well, I saw something on the internet, whatever. I say, if that was truly the case, nobody could hide it. You'd have lots of cases of it, people stepping forth and saying, oh, this happens and that happens. They have a vaccine adverse event, a reporting site, and people add to it all the time and say, I'm having this, I'm having that. There's been no issues with the hair loss as a problem. So great question, Tyrone. You the man. Okay, Sabrina Medley, will liposuction alone help with weight loss? Absolutely. But weight loss is several things. One, how much you want to lose. Number two, how quickly you like to lose it. And when you have a lot to lose, you lose more and you lose quicker by utilizing multiple products that attack the weight loss problem from multiple avenues. So if you go to our website, lipodrops.com, it will ask you certain questions and it will direct you as to what your objectives are and what you'd like to do. So how quickly you want to lose it, and everybody wants to lose it yesterday. But oftentimes people will have an event coming up, like a wedding or a class reunion, and they say, I need to lose so I can fit in this outfit. That's men and women. So so to get the better response, you would utilize, say, the maximum strength lipo drops versus the original lipo drops formulation. You would get a quicker response and a more dramatic response, and then you add things like our probiotics and our lipo cleanse, and you will get a more dramatic weight loss. But We have a combination of products called the Belly Fix that concentrates on abdominal fat. So you will just go to the website and it will inform you and guide you for a custom response to what exactly your needs, wants, and desires are. So to answer the question, is Lipo Drops alone will? A lot of people just take the Lipo Drops, but again, depending upon how you like to sculpt your body, other products may also be recommended for you. So great questions, Sabrina. Thank you very much. Okay, Kevin, I have one more question. Kevin, you're not limited. You can ask as many as you like. I got the Moderna vaccine. Can I get the Pfizer as my booster, or should I stick with Moderna? If you get the Pfizer as your booster, you're moving backwards. The Moderna is the best vaccine. It's the most potent. It causes the greatest immune response. If you are fully vaccinated with the Moderna, you got 2 shots. You don't need to get a booster. It's just your immune response is good, is great. Getting a booster probably won't harm you. It will probably improve your immune response, but how good is good? You're already at Bentley level protection. So, if you go down to, something less than a Rolls Royce or a Bentley, you're going to get less than a Rolls Royce or a Bentley response. And what you have here is a great coverage with the Moderna. Again, the studies that were submitted asking for booster status did show an improvement in the immune response. But the question, and the scientists are saying, and the doctors are saying, this is not just Dr. Collier's opinion, that, how good is good and how much is enough. If you got 2, you didn't have side effects, and you're doing great, then you probably don't need a booster, particularly with the Moderna. If you have some health challenges, like you're immune compromised, or there was some concern about your body's response, you can have your antibody level checked and then determine whether you need to get a booster or not, or you can just get the booster. I really don't think there's going to be any downside to getting a booster, but my emphasis, and the emphasis that's being recommended to all, is that we get people who haven't had one shot, at least one shot, so that we can get this herd immunity going and we can get back to our new normal. The coronavirus isn't going anywhere. It will be around. We'll always have to be concerned about it from this point forward. But at least if we can get it under control, and it comes, on an irregular basis, and there are times when it outbreaks, like wintertime or whatever, then we can get back to doing those things that we like to do, going to our usual workplaces, doing our usual and customary activities, and then, getting some semblance of life back that we can all enjoy. All right. Great question, Kevin. All right, Ursula Clark Holmes. How long do you need to take the drops to keep up your weight loss? Some people stop as soon as they have accomplished their weight loss goals. What I recommend is that you at least keep the product around and use it for maintenance, meaning you use it at least once a day with one meal just to keep your weight down. If you stop using it and you see that you're starting to regain, because this is what happens oftentimes, people celebrate weight loss by eating more, eating things they had taken out of their diet, and celebrating, because the first few times they do it, nothing bad happens. They eat a piece of cake, they eat a pie, they eat some cheesecake, and they don't gain 5 pounds. The next thing you know, they're eating cake, pies, and cheesecake on a regular basis. Now they are starting to gain weight. So I tell people, if you have gained 3 to 5 pounds, you can knock that off in a very short period of time by resuming the product. If you wait until you've gained 20 pounds back, then you're going to have to basically do the program over again. There's no drop in the efficacy or no change in your body's response to it, because it alters your metabolism and your body's ability to metabolize fat effectively. There's no tolerance to that. Your body doesn't get used to it, learn how to undo it or whatever. It will still respond. But the idea is, once you have lost the weight, to keep the weight off. That is why this product and this program is so effective long-term versus your traditional calorie restrictive, play things like Weight Be Gone, I'm Too Fat. Every strip mall weight loss program that's out there that will make you lose weight. If you do what they tell you to do, exactly the way they tell you to do it, you will lose weight. It happens 100% of the time. The problem is the average weight loss for a person that needs to lose weight is 20 to 30 pounds. The average weight gain, when they gain it all back, is 25 to 40 pounds. And so the problem is that once you stop doing those things, your body wants to go back to its previous set point. Your body drives that. There's a hormone called ghrelin. I call it ghrelin, the gremlin. That hormone tells you to eat, to stay and maintain that body weight, whatever that number is. And the more weight you lose, the higher that hormone level gets. It keeps telling you, eat, eat, eat. And you have to fight that ghrelin the entire time. The magic weight loss product that when someone develops an anti-ghrelin formulation, then everybody in America will be slim and trim, because it's going to control that. But right now, that hormone drives you to eat, it makes you to eat, and the only relief is to gain the weight back. And so some people just aren't comfortable in a smaller status because that hormone is continuously messing with them, so to speak. And so now, we're learning this, and that's why it's best to just keep your body's ability to metabolize the fat at a high functioning level. That's what the Lipo Drops line of products does. Great question, Ursula. All right. So Diane Pankey is all right to take vitamin B, of course. Vitamin B12 is what I recommend, and that's now vitamin B12 is in the Lipo Drops. So that's one of the key ingredients because B12 gives you energy. Everybody knows that. Everybody said, "What does B12 do for you?" It gives you energy. Yes, it does. But more importantly, B12 turns on your body's weight loss mechanism. B12 does not make you lose weight. It has no ability to do that. But what it does is tell your body, because weight loss is an abnormal condition. Your body does not like to lose weight. Your body does not want to lose weight. It is very difficult to do that. B12 tells your body, okay, we're going to go on a weight loss program. It's okay to do so, so don't fight me so hard. And so B12 turns on the weight loss mechanism. That's why it is a key ingredient in most medical weight loss plans. Plus, it gives you energy while you're losing the weight. A lot of weight loss plans make people so fatigued, they just feel so blah that they don't want to continue the program. They're losing weight, they're having success, but they feel bad and they feel tired and they feel fatigued. So B12 boosts your energy up and stops you from having that as a potential side effect of weight loss. So yes, the point being, you can take vitamin B12 if you like, but it's in the Lipo Drops Maximum Strength at a dose that's recommended. You can take supplement of B12 if you like. Ideally, you want to take B12 sublingually under the tongue by either taking drops or taking a tablet that dissolves under the tongue. Any other oral B vitamin tablet that you swallow, your stomach digests it. You don't get adequate amounts of whatever dose you're taking. So the ideal way to take B12 is either get injections at the doctor's office or get the sublingual products that you can buy almost anywhere over the counter now. Great question, Diane. We appreciate you. Trish Simons or Simmons, what I think of CMOS gel. I'm very familiar with CMOS. I'm not sure what the gel does. I don't know whether that's oral or topical, but CMOS as a product itself, I do endorse for general overall health, for its immune stimulating capabilities, as well as weight loss, because it helps decrease your appetite. So CMOS is one of the products that I do recommend. It depends on where you're getting it, how it's applied, what dose. People ask me, what dose do I take? It depends on the product that you're getting. So I would look and see what the label says and take it as directed in doing so. But again, helps with building your immune system. But you can take out all your guesswork. Our Lipo Immune product is amazing for that because it contains multiple immune system boosters. Our Lipo Immune Plus, our Doctor's D, gives you the ultimate immune boosting package because you have vitamin D, you have zinc, you have elderberry extract, and you have another product. I can't think of what it is right now. But those things, and they are all shown to be amazing as far as B12, B12, zinc, and elderberry extract, and then the vitamin D from the Doctor's D, which is 5,000 international units per day, which is the recommended dose to boost your immune system and to protect your body and limit your body's susceptibility to cancer, such as breast cancer, colon cancer, cancer of your female organs. For men, prostate cancer. Vitamin D levels are absolutely incredible. And the first thing that happens if a person is diagnosed with cancer and the vitamin D is low, and the vitamin D is always low, is they place them on vitamin D, a perfectly natural, non-toxic way to fight that cancer. But guess what? If you take the vitamin D and get your vitamin D levels up, you won't get the cancer, and you'll respond much better and have a longer, healthier life. African Americans in particular are more susceptible to the big three chronic disease states: high blood pressure, diabetes, high cholesterol. Those three things, the metabolic syndrome, result in high rates of heart attacks and strokes. Black people die from heart attacks and strokes. Everybody dies from heart attacks and strokes, but disproportionately affecting people of color, African Americans. So it's very important that we keep those things under control. One of the best ways to do that is maintain it as close to your ideal body weight as you can. But even if you're nowhere near your ideal body weight, just an elegant weight loss of, say, 5 to 10% of your body weight will make a major difference in your body's response to those health challenges. Even though you might not be slim, trim, and skinny, you still will be much healthier just by losing those amounts of weight. So that's what we recommend. All right, final question.
Got any more pipeline, Antonio? Okay. Tam Scorpio's finest. I'm so glad to hear from you, Tam. I was going to say, where is she today? Okay, I know you said this before, but can a teenager use lipo drop? The recommended age group and what's on the label is ages 18 and above, but I have heard anecdotal stories of people using them in teenagers. The teenagers nowadays are bigger than the parents. Most of the recommendations for things like that were based on size, and a 12-year-old was half the size of an adult. Nowadays, 12-year-olds are twice the size of an adult. So, but again, because there's no stimulants, there's no medication in them, there are supplements that contain amino acids, which are perfectly safe. Then that's why I can see why people are doing that. But Dr. Collier's official recommendation is that ages 18 years and above. All right. So this brings to a close this edition of the Your Health is Important Facebook Live broadcast. We are so glad that you tuned in tonight. As always, the questions were phenomenal. Everybody just, asked. We're all over with that question, particularly the great question on Guillain-Barré syndrome, which now people know is an ascending paralysis. We talked about the methodologies for losing the weight. We talked about booster status. Should you get a booster? Should you not get a booster? If you haven't been immunized, get the immunization. Ladies, your father, your brother, your significant male other. If you have a man in your life and he has not had the shot, please take him tomorrow to get the injection so that he will be safe. He will be there to take care of children and family and be your significant other, be your husband, be your spouse. And, you just take away the worry, the sweat of everywhere I go, everything I do. Do I need to wear a mask? Do I need to wear gloves? Am I going to catch this virus? I have had so many patients with disorders. One of the people in the relationship got the vaccine, the other one did not. Even if both of them get sick, the person with the vaccine does better, goes home. The person without the vaccine in the hospital on a ventilator, and sometimes with poor outcomes. I had a patient. She was 25, her husband was 29. That's what happened. He died. She said, "I never thought I'd be a widow at 25 years old. Hadn't been married less than 2 years." A tragic situation indeed. And the first thing said, "I wish I had listened to you and gotten the vaccine." Because once you're in the hospital about to go on the ventilator, it's too late. It won't help you at that point. You have to have it, and it takes 2 weeks for it to kick in and actually give you some real benefit. So get the vaccine, get the vaccine, get the vaccine. In closing, thank you so much once again. We'll see you on the next Facebook Live presentation. You'll hear me and listen to me every morning on the Ricky Smiley Morning Show. We're so glad to be your medical ready reference. Dr. MJ Collier, we're out of here.